Hi, I'm Jackie Sanders from WAVE Physical Therapy, and today we're talking about shoes and shoe selection for a walking program. So if you're getting ready to start a walking program, investing in a good shoe is an important thing to do. You're going to take about 1.2 to 1.5 times body weight through every step that you take, and so getting the shoe that's right for you is important. You'll want to find a shoe that is similar to the heel stack that you are accustomed to. So if you are someone who wears a lot of high heels, then your heel stack, which is how far above your heel from the foot, the difference between those two is, then you'll want a higher heel stack. If you're someone who walks around in a lot of flip-flops, a lot of Keds or Toms, then you can go with a lower heel stack, very minimal, because your foot is used to being very parallel on the ground. Also a note about the different shoe types. Just because a shoe is a stability shoe, we can start to think in our minds like, well, that's going to be really good for my foot because stable is better. That's not necessarily the case. A stability shoe will have an additional piece of material. Often there is a different color or a different material altogether that runs from the rear foot to the midfoot of the shoe. Now, this is not a stability shoe, this is a neutral shoe, but you can imagine that this piece right here would look very different from the rest of this part of the shoe. And this is intended to delay rapid or overpronation of the foot. We don't need to add an insert the vast majority of the time. Most of the time, an insert is really an upsell. The time that we would use an insert and we would need to make a rear foot and then lateral to medial post is if we lose control of the foot well past mid stance, where the stability in the shoe is actually not useful because we're losing control much farther in the step. All of that to say, it's really important for you, if you're going to begin a walking program, to have someone who is really experienced, or like a physical therapist, look at your foot, see how your foot responds when it hits the ground, and make sure that you have enough but not too much stability in your shoe. Happy walking.